Acid peptic disease. Acid peptic disease refers to a group of disorders that involve the stomach and the duodenum, the first part of the small intestine. These disorders are characterized by the erosion of the protective lining of the stomach and/or duodenum due to the excessive production of stomach acid and the impairment of the protective mechanisms in the digestive tract. The main conditions under this category include peptic ulcers, gastric and duodenal ulcers, and gastroesophageal reflux disease, GERD. Causes. The primary cause of acid peptic disease is an imbalance between the aggressive factors, such as stomach acid and pepsin, and the protective factors, such as mucus and prostaglandins, that maintain the integrity of the stomach and duodenal lining. Factors that contribute to this imbalance include Helicobacter pylori infection, a bacterial infection that can weaken the stomach lining's protective mechanisms. Non-steroidal anti-inflammatory drugs, NSAIDs, prolonged use of drugs like aspirin, ibuprofen, and naproxen can increase the risk of peptic ulcers. Smoking. Smoking can increase stomach acid production and reduce the stomach's ability to defend itself. Stress. Severe stress and trauma can lead to an overproduction of stomach acid. Diet. Consuming spicy, fatty, or acidic foods may exacerbate symptoms. Signs and symptoms. The signs and symptoms of acid peptic disease can vary depending on the specific condition, but common symptoms include burning sensation, a burning pain in the upper abdomen, often referred to as heartburn. Abdominal pain, dull, gnawing, or sharp pain that may come and go. Nausea and vomiting. Nausea, and in some cases, vomiting, can occur. Bloating, a feeling of fullness or bloating after meals. Belching, frequent belching or burping. Regurgitation, the sensation of stomach acid or food coming back into the mouth. Chest pain. In the case of GERD, chest pain resembling heart pain, angina, can occur. Treatment. The treatment of acid peptic disease aims to alleviate symptoms, promote healing, and prevent complications. Treatment options may include lifestyle changes, avoiding trigger foods, quitting smoking, reducing alcohol consumption, and managing stress. Medications. Antacids, over-the-counter medications that provide quick relief by neutralizing stomach acid, milk of magnesia, Pepto-Bismol, etc. H2 blockers, prescription medications that reduce stomach acid production, ranitidine, famotidine, nizatidine, cimetidine. Proton pump inhibitors, PPIs, prescription medications that block acid production more effectively than H2 blockers, omeprazole, esomeprazole, lansoprazole, rabeprazole, pantoprazole. Antibiotics. If H. pylori infection is present, antibiotics are prescribed to eradicate the bacteria, triple therapy, quadruple therapy. Surgery. In severe cases or if complications arise, surgical intervention might be necessary to repair or remove damaged tissue. It's important to note that self-diagnosis and self-treatment are not recommended for acid peptic disease. If you suspect you have this condition, it's best to consult a healthcare professional for proper diagnosis and treatment.